There we go. Okay, we're recording now. So welcome everyone. Welcome to our Alanda's new webinar, The Path to a Successful Career in Public and Global Health. We're super happy to have you here. I hope this webinar is useful for you. And let me start by introducing myself. I am Candela Iglesias. I'm the founder and director of Alanda. And about 12 years ago, I was finishing my postdoc in the biomedical sciences. I had dedicated 10 years of my studies to the biomedical sciences. I did a bachelor's, a master's, a PhD, and a postdoc. And all of a sudden, I had decided that I wanted to leave academia. And like many of you might feel today, I had no idea where to go next or even how to go next. Like I knew how to find a postdoc or a job inside of academia, but outside of it, it was a big world and a scary world. I didn't know anything about how to tackle it. So fast forward 12 years, and I have worked with a variety of different organizations over the year. I switched my career towards global and public health, and I ended up doing all the things that I wanted to try out and that I love. I've worked with everything from government, ministries of health, academia, NGOs, hospitals. I've collaborated with many international NGOs and even biopharmas. So I've gained a wide variety of knowledge in the different players in the global and public health arena, and we'll be talking a little bit about that today. But all that to say that I have been where you might be today, very unsure on where to go next and how to get there. And we hope to answer some of those questions today in this webinar. I think I want to start us off with a quick question. And before going there, I just want to say thank you to Valerie Balver, who's here with us today, but she's off camera. She is the organizer of this fantastic webinar and the person you've been hearing from, both on LinkedIn and on email. So thank you, Valerie, for organizing all of this. I think it's going to be a fantastic webinar. Let's start with a question, and then I'll share a bit of the agenda for what we're going to be doing today. Valerie, do you want to put the Mentimeter on? You are going to see a link on the chat that says menti.com. If you click on that, you can answer a question directly on your browser. And that question is, if you can say it in one or two words, what are the big challenges or the main challenge that you're facing today in your career development and job hunting in global health? And then Valerie is going to show us the results as they come in, so we can get a little bit of our understanding. Rejections, job hunting, networking. Rejections, yeah, competition, okay. There's a lot of competition out there. More rejections, experience, job opportunities, lack of something. Intercultural understanding, what to look for in a job. Wow, this is fantastic. Thank you for playing, people. This is amazing. Networking is big and growing in there. Job title search, yes. Experience, job positions, opportunities, no jobs, skills. Wow, this is moving too much. I can't even read it anymore. This is great. Okay. Perfect. Great. So I think we're hearing a lot of the themes that we are going to be covering today. So it reassures me that we are on the right track with this webinar. We are especially going to be talking about the power of networking and how to do it correctly, among other things. And we'll touch on many of those other words that you were sharing here today. So I think we're off to a great start. So Valerie, if you can put on the agenda for today, let me talk to you a little bit about why we created this webinar. What has happened over the years is that I have started receiving more and more requests to talk to people informally and to mentor people informally. And I do a lot of mentoring formal mentoring in different programs, and I do a lot of mentoring for our own team and our own interns. But I was getting a lot of requests to talk about, where do I go next? How do I get there? How can I manage this going forward? And unfortunately, as much as I love having those conversations, there's only so many hours I can dedicate to that. Otherwise, I don't do my real job. So some years ago, we decided to get started on these webinars because it's a way to reach out with these answers to more people. And they've been quite a bit of a success, so we're happy to continue having them. And then recently, Valerie came up with a bit of a change in the idea of this webinar. So today we actually have an exciting guest that is here with us today, and will share some of her own experience. So what are we going to cover today? First, I'm going to go through some of the most common questions I get from young public and global health professionals or students. It seems like there was a technical glitch. Can you hear me now? Yes, perfect, great. Thank you for that. Internet connections problems. So just about the agenda, first I'll be answering your questions, the most common questions I get from young global and public health professionals, young professionals like yourselves on career development and job hunting in global and public health specifically, so still in our sector. And then we're going to talk a little bit about how Alanda has been supporting recent graduates and people who are switching careers into global and public health to find their first job. And this is where we have Dina, who will come in as a guest, and I'll introduce her later to you. She's amazing, and she's been part of one of our cohorts for Thrive. So I'll talk a little bit about the tools that you can get through Alanda's courses and communities. And then at the end, we'll have questions for you to ask any questions that you want. We'll have I'll hope a good 15 to 20 minutes so I can answer any questions that you still have. And I'm sure there'll be lots of them, and they're always very good. So I'm happy to answer those. Great. So let's get started with part A. And I'm going to start answering the most common questions I get. And those three questions are, what are my options in types of jobs and organizations in global and public health? The second one is, why am I getting so many rejections or no answers? What is going on there? And the third one is, how do I network? How do I network correctly? And people don't necessarily know how to ask this question, but we see a lot of not very good networking out there. So we're going to talk about how to do it right. Before we get there, I just want to, interact a little bit with you guys. I can't see you, but I can read you, and that's always very cool. So how about if you type in the chat, yes, just a yes or a no as an answer to this question. Do you personalize your cover letter and your CV, your resume, for each application that you send out? We're getting a lot of yeses. Yes, that's brilliant. Very good. Oh, this is so good. Okay. Brilliant. That's very good to hear. Just know that not my resume, but my cover letter, yes. Okay, yes, I do. Yes. Just keep in mind that for our internship applications, we receive about 250 applications every time. And I would say probably about 30% of those are, standardized CVs or, non-personalized cover letters. They don't even mention Alanda. Those type of resumes, that's shooting yourself in the foot. That's really not playing to win. So the very easy thing you can do is personalizing your cover letter and CV, and we'll talk a bit more about that later. But that was just to get us warmed up. Let's talk a little bit about the first question I get, and that is, what are my options out there? What are my options in global and public health? I think most of you understand the options inside academia well, because you might be finalizing your studies in global and public health, so you know that there are options inside academia. Now, let's just first expand the concept of academia from universities and university positions to everything else that is out there that could also be considered academia. And this could be, research so research inside think tanks. There's a lot of think tanks, many in global and public health. It could be national institutes of health, who also do a lot of research, usually much more operational research than more biomedical or more theoretical research. There's many hospitals that actually also conduct research and have hire researchers. So there's a lot of options. Now there's more and more academic partnerships, which require project managers and people who understand the project management side and working with a variety of different stakeholders to bring them together. So these are options we don't usually think about. So that's just one way to open up the academia box. Second, we have everything that is health and healthcare organizations, which they usually need public and global health specialists in different positions. And here I'm talking everything that is Ministry of Health related, from the very, community level healthcare center or public health and surveillance district, office, to all the way to the Ministry of Health, and on both sides. So you have like the public health and surveillance side, let's say, and then you have the actual healthcare side, and then you would have primary healthcare, secondary healthcare, and tertiary healthcare centers. So from maybe you won't find that position in a very, very small health post, but definitely as the structures get bigger, there's more and more need for public health or people with knowledge of public health and epidemiology in different positions. So everything healthcare is another box that you can search and see if there's opportunities for you there. Then we have NGOs, not-for-profit organizations. And again, you might be thinking about the big ones, the ones that make a splash in the news: Doctors Without Borders, CARE, the Red Cross. So those are the big international NGOs, Save the Children. But then you have a lot of national NGOs that also work either nationally or internationally, but they're just not as big as these ones that we all know. So whatever country you're in, it's always good to try and get a list of the NGOs working in health in your own country or the country where you would like to work in. And then you have the local ones, the community ones, the grassroots ones. And of course, there's less positions here and there's usually less money, but you might be able to start more easily in a volunteer position there and then gain access to employment in these sort of more local level organizations. And there's organizations that, do implementing, there's organizations that do advocacy work, there's organizations that do health promotion, health communication, that support surveillance, that support health equity. There's a huge variety of thematics here. So whether you want to do health policy or you want to do health programs, there's definitely a local organization that can cater to your needs. So go out and find them. They're not as easy to find because not all of them have even a web page, right? So you're going to have to do a little bit of digging. What else do we have? We have multilateral organizations. Multilateral means that it brings more than 3 organizations together. And basically under this category, you find everything that is UN based. In health, the UN organizations that have like a health component, of course, is WHO, but also its regional offices and its local offices. So not just WHO headquarters in Geneva. You would have UNICEF also has to do a lot of health. UNDP does a little bit of health. FAO and the World Food Program, of course, have some health components, nutrition mostly. But yeah, there's quite a few of UN-based organizations that have some health components apart from WHO. So WHO is not the one all end all, right? We have other multilateral organizations that bring together different groups or different donors. You have Gavi, the Vaccine Alliance, for example, which also works quite internationally and across borders, I would say. You have the donor organizations, and this is a category that people don't usually think about. And here is where the money is actually. So donor organizations go from many governments in high-income countries and even middle-income countries have their own aid agencies. It's NORAD in Norway, it's SIDA in Sweden. In the UK, it's been changing names so fast it's hard to keep up, but it's the UK aid agency. You have a USAID, for example, in the US. So find those organizations, and these organizations need people with for their health programs that have public and global health skills. You have the big donors that we all know about, the Global Fund, the Bill and Melinda Gates Foundation. Now the new big player in town is the Priscilla Chan and Mark Zuckerberg Foundation, or also called the Facebook Foundation. You have, and then one category that is often overlooked is many biopharmaceutical companies, Merck, like all the big ones, have foundations that work on health issues. So look into those as well. And many of these have global offices, but they also have regional or even country offices. So there's opportunities in many countries. That's for donor organizations. And then you have all the small foundations, and in every country in the world there's foundations. So there's rich people who set up a foundation, personally, or bringing together other people. There's a lot of opportunities in foundations, and many of these foundations work in social or health topics. So they need the skills that you have, that you bring. Look at those lists of foundations at the national level, and then at your local level, the state level, district level, whatever it is. And there's all sizes. There's foundations that have maybe 5 employees, and there's foundations that have, 100. So there are opportunities there. Of course, you have private companies. You have all the biopharmaceuticals that are the ones we tend to think about. And there are some opportunities for global and public health, especially if you have good EPI skills. There are some opportunities there. Now with One Health, that is extending to biopharmas or pharmas that work with animal-related health. So that's another area that you can explore if you're interested in One Health. But there's also, in the private sector, there's all the organizations that cater to the needs of all the other organizations that we just talked about. So there's consultancies, there's support services, there's technical assistance, there's a lot of small organizations that have a niche specialty and that provide services to the other organizations that we've talked about. It's not only consultancies. You have, for example, interesting groups or companies, or it might be not-for-profits, but they're not an NGO the way we normally think about an NGO, that provide services to write grant applications for funding, for example, for the European Union grants, which are quite hard to get, or that help to manage consortia of different organizations. So there's a lot of opportunities there, and these are the ones we maybe don't even know what they're called. So it's just a little bit a matter of exploration of what's available in your country. But there's a huge variety of small organizations catering that are private and cater to the other ones, services to the other ones. And there's more and more a very interesting thing called public-private partnerships, and many of this involve usually a consortium of universities and pharmas, for example, and they need people as well with public and global health skills. So those are opportunities that you might want to look into, and you might see some of these public-private partnerships in the web pages of big pharmas or of universities, so look into those as well. And of course, there's health associations, there's advocacy groups. Many of these don't necessarily have a lot of paid positions, but it's still worth investigating. So I hope with that I've opened up a little bit the world of opportunities out there with the global or public health skills for you, beyond the typical of what you would learn through your academic studies. I just wanted to say, if you have questions, we're going to tackle all the questions at the end, but just, start writing them down. And if you want to type them into the chat, that's fine. Just know that we are paying attention to them. I'm just not going to answer them immediately. That is for question 1. The second, most common question that I get is, why do I keep getting rejections or no answers to my job applications? And this usually, the underline to that question is, what am I doing wrong? So the first thing that I want to say about that is, you're not doing anything wrong. That's how the game is played, and it's a very tough game. So if you're in the middle of job hunting right now, know that I've been there. I know how hard it is, and I feel you, and we're going to talk about how to make it better here. What is the problem? Why so many rejections? I think the main problem that I see is that when we're students, we know that if we work hard, we get good grades. It's quite direct, right? It's quite, we put in the work, we put in the hours, we put in the effort, and then we get results. When you're job hunting, you put in the hours, you put in the efforts, you send a ton of applications, and then it's crickets. It's like nothing's happening. I'm not hearing back. Or if I hear back, it's a rejection. And then it's so easy to get discouraged. So the first thing to know is that I have 2 phrases about job hunting. The first one is, job hunting is a full-time job. And the second, so, make it the time for it. It's going to take a lot of time. And the second one is, job hunting is an exercise in rejection. So as much as possible, and I know it's easier said than done, don't take it personally. It's not about you. It absolutely is not about you. It feels that way, I know it, but it's not. So what is the problem? I think one of the main problems, and something that they don't teach us during our studies, is that you are most likely applying for jobs that are advertised somewhere. So you're looking in Glassdoor, you're looking in Impact Pool, you're looking in Relief Web. I don't know where you're looking for jobs, but you're looking in some sort of search engine, and you're reaching jobs that are advertised. Let's start with something that I call the iceberg analogy. And if you've been following Alanda for a while, you've probably heard this before. We talk about it a lot. The iceberg analogy is, how icebergs are. You have the tip of the iceberg is the only part above the water, and it's, a tiny percentage of the whole iceberg, and the majority of the iceberg is below the water, and you can't see it. It's the same for jobs, actually. The tip of the iceberg are the jobs that you're seeing in this job searching engines, the jobs that are advertised. The bulk of the iceberg, the part which is underwater, is all the rest of the jobs that are out there and that are never advertised. And if no one told you this before, that is something that we're not doing right in universities. We need to teach students about this reality. Okay, the majority of the jobs out there are never advertised. And this is true no matter what country you're in. Okay, the percentage of jobs that is above water that gets advertised versus the percentage of job that's below the water will vary from country to country and from city to city. And also from sector to sector, the public health, the public sector, and some biopharmas might have very strict requirements on advertising all their jobs. Just remember that because a job is advertised, that doesn't mean that they don't already have an internal candidate. Okay, so this is what I'm saying. It's not about you. It's not personal. This is what I mean by that. Okay, so the iceberg problem. Between 50 and 90% of the jobs available will never get advertised. Those are jobs that are filled how? They're filled by internal candidates. They are filled through networks, internal networks. what you need to understand is that a recruitment process is expensive, it's time consuming, and it's resource intensive for any organization. So a lot of organizations try as much as possible to avoid that through referrals, recommendations, internal recruitment. Okay, and many do need to go, because of rules and regulations, they do need to post their jobs, and that's great. And they might, give that job to someone else if they find a fantastic candidate, but they might already also have one or more internal candidates to consider. Okay, and many are going to, and what happens, that those jobs underwater are also jobs that organizations didn't know that they needed. So what usually happens is an organization is struggling because all of a sudden they have more work that they can manage. They don't have time for a recruitment process. And then someone comes in the door because, in a team meeting, someone said, oh, I have a friend that is great at this. And they recruit them. They create a position for that person because the person came in at the right time. Again, this is not about you. You see how this is not about you, okay? So the iceberg problem is a real issue and is a real problem, which means how does this translate? What it translates is that if you're only applying to jobs that are being advertised, you're only tackling the tip of the iceberg. You need to divide your time by tackling the tip of the iceberg and the underwater part of the iceberg. And the question is, how do you do that? How do you reach jobs that are not even advertised? And that brings us to our third question, which is the power of networking. Before we get there, I have another Mentimeter question that I want to use. So Valerie, if you would post it in the chat, and people, if you can just go and click on that link and answer the question, we are going to see it appear on the screen. And the question is, in the last month, how many people have you reached out to on LinkedIn or by email to ask about their career path, their job, or to ask them for advice? So here is the link for Mentimeter in the chat. Go and click on it, and I want to see your answers. And Valerie is going to share her screen, and we're going to see it appear here. Zero, 4, 5, 6. Wow, there's some very active people out there. Brilliant. We have 78 attendees. I don't think we have 78 answers yet, so I'll wait a little bit longer and see how this is looking. Has everybody had a chance to answer? Are you having trouble with Mentimeter? Okay. Great. Okay, so I have 11 people who answered 0. 5 people who asked 1, so a lot of people, very little networking activity, and then some people who are doing really good with 2 or 3 tries in a month, and some overachievers out there, which is great. Well done, people. Okay, so that's great. That gives us a little bit of an idea, and it also gives you a little bit of an internal idea for yourself, depending on how you answered, on where can you redirect your efforts. Let's talk about networking. And if you're rolling your eyes at me right now, just give me a second. Bear with me for 5 minutes, and I hope to change your mind about networking. If you think networking is fake, it's yucky, is not for introverts, it feels like you're just, trying to be nice to people to get what you want. Hear me out, okay? Let's change your concept about networking. So let's get out of the way what networking is not. Networking is not a one-off chat with someone at a conference. That's not networking. That's great. It's a great start, but that's not networking. Networking is not writing to someone you don't know on LinkedIn and asking them for a job. That's not networking, okay? What networking is building long-term relationships with no agenda. That's the ultimate networking strategy. You're starting to build long-term relationships with no agenda. What do I mean by no agenda? You're not necessarily looking for a job, even if you are. You're not necessarily asking for a job. You are reaching out to people because you find them interesting, you find their organizations interesting, and you really want to know more about them and or hear their advice, like truly and honestly, okay? That is what networking is. How do we do networking in a positive and hopefully useful way for job hunting? And you're probably thinking, hey, but I need a job like now. Like, what is all this long-term relationship building? You know, I need a job tomorrow, okay? I get it. And that doesn't mean that you need to sacrifice the short term for the long term, but it means that the strategy more or less remains the same. I see networking as continuous light touch points of contact with people that you care about. So that doesn't mean that you're going to send them a message on LinkedIn each week. It might be, once every 6 months, once a year. Let me tell you about one amazing example, and I have plenty like this, but just so you get a bit more clarity on what this could look like. About 7 years ago, I met a young public health professional at a training. We were both being trained by the Red Cross, and we clicked because we both had a biomedical background. That was sort of like our point of connection. So we chatted a lot during the training, and she's like about 10, 15 years my junior. Immediately after the training, she reached out to me, we connected, and then ever since then, she has been extremely good at keeping the contact going between us. And that doesn't mean that she's reached out to me every day. It doesn't mean that she's been reading all my posts on LinkedIn and liked all my posts or whatever. It means that every 6 to 8 months, about twice a year, sometimes less, sometimes more, she sends me an email or a message on LinkedIn saying, hey, this is where I am at my career, and I've been having, challenges with this and that. And if you're available, can we meet for coffee? And would you have a bit of time to chat to me about this? And could I get your advice? And the fact that she's been connecting with me repeatedly and keeping me posted about her path, that has made me happy to have those chats with her. And it's not a big amount of time that I need to dedicate to this. That is a great way of doing it. And what she has actually done very smartly, without ever saying it explicitly, is that she has recruited me as her mentor, right? So recently, she finished, she worked for a bit, then she did a PhD, and then now she's looking for a job. And she said, hey, now in this new phase, can you just, can I hear what you have to say about this? So we sat and we chatted about it. And then she asked me for a recommendation. Do you think I gave her a recommendation? Of course I did. I know this person. I know her career. I know how hard she's been working. I know her achievements. And it hasn't taken a huge amount of my time. These are the type of relationships you want to be building, not only with people who could become your mentors, even if the title is not formal, but also with your peers. And for your peers, think about this. The people that I studied with, my bachelors, some of them now are at the top of their careers. I have a friend that is the director of a research institute. I have a friend who is the head of an international agency. So the people that you study with, they're going to continue advancing in their careers as you are. So make sure to keep those connections alive, because you already have them now. And many of these people maybe are even your friends. Okay, so don't forget to keep those connections alive. So a big part of networking is keeping connections alive. And the other big component is creating new connections. So how do you go about creating new connections, and especially with the intent of job hunting, the intent of getting to those jobs that are never advertised, that are below the water in the iceberg model? I'm going to walk you through it. I'm not saying this is the one and only technique, but it's a technique that really works, and we'll hear a little bit more about it later, because some people, many of the people that participate with Alanda in different courses, they've tried this for themselves. So you don't need to take my word about it. You find people. First, you need to have clarity on which organizations are interesting to you. So you create a list of those organizations. From that list, you try and find people on LinkedIn that work today or have worked before in that organization. And then you reach out to them. You can't ask someone who doesn't know you for an hour of their time. That's not going to work. So make it quick. Say, can I have 10, 15, 20 minutes of your time maximum for a quick virtual chat? And you need to have a very good reason why that person is going to give you their time, which is a precious resource. And you can say very simply, I am at a new stage. I'm exploring the opportunities out there in global and public health. And I see that you've worked for this organization, and it's one organization that it's on my radar, but I would really like to understand exactly what the work inside that organization looks like. Here, point number one, I'm never asking for a job. I don't even make it sound like I'm looking for a job in that organization. The thing is, if people even smell that you're like going to ask them for a job, they're going to back out. Most of these people are technical people. They're not HR people. It's not their job to recruit anyone into the company or the organization. So if it ever sounds like you're looking for a job, they might not say. Your chances of getting a yes decrease. So what you're looking for is advice. So you can make it explicit. I would love your advice based on your career trajectory, which sounds very interesting, of the type of organizations that match my interest. Whatever you do, ask for advice, don't ask for a job. Here's a big secret. We're all human beings, and one characteristic of human beings is that we all really like giving advice to others. And think about it for yourselves. When someone comes with a question, you're already thinking about how to help them get to a solution. And that's advice. It's just human nature. There's nothing wrong with it. So you can leverage that commonality among humans that we love to give advice by asking for advice. When you ask for advice, your chances of getting a yes to that request will skyrocket. Okay, that doesn't mean that everybody's going to say yes, but I promise you, you will get some yeses. Some people are very busy. Some people don't check their LinkedIn. Some people, whatever. Don't take it personally. There are people who are going to say yes. I've said yes to thousands of these requests. I have friends who have said yes to thousands of these requests. There's people out there that even if they're busy, they're going to make the time to help others out, especially if it's just 10 to 15 minutes of their time. Okay. So try it out and let me know how that works. Do I have anything else to say? Let me check my notes. Yeah, okay, great. I think I covered everything there. So those of you reaching out to people on LinkedIn, I hope you're doing this the right way, and I hope you're getting really good responses. And I hope that I've changed your mind about what reaching out on LinkedIn looks like. If you're reaching out to just get a connection, that is not going to take you places. What you're building is a relationship. So you need to start a conversation with that person. So what happens next after you actually manage to connect with that person and chat for 10, 15 minutes? What you're going to do is make sure that you continue those light touches that I talked about. So, the next day you just send a quick thank you note. Then a month later you say, hey, I read this post that you wrote on LinkedIn. It was super interesting. Or you comment on their post, but now they know who you are. And then maybe in 6 months you say, hey, 6 months ago you talked to me, you gave me this advice. It was super useful, blah, blah. And the other important thing when you have this first contact with this person is that you ask them, based on what I told you about me and where I want to go, who should I talk to next? And this, my friends, for who remember their qualitative data collection techniques, this is called snowball sampling. So you ask each person for the next person's name. And that way you keep building your network, okay? How is this going to take you to a job? First, you can always say, if there's any, at the end of that chat, you can say, your organization sounds amazing. If you ever hear about some opportunities, please do let me know. I'll be very attentive to their website. But I know that maybe not everything gets advertised. So, just plant the seed of interest there. It doesn't mean that you're going to get a job immediately, but it means that you're building the connections that could eventually lead to a job. So hopefully you're doing at least 50-50 efforts above water in the iceberg and below water in the iceberg. I think that is more or less a good balance. Okay, that's enough me talking. So what I want to say next is what Alanda does to help young public and global health professionals and people who want to switch careers into global and public health in their career development and job hunting efforts. Everything that I might have just told you maybe sounds really daunting and really challenging. And many of you might be doing this job hunting at the same time as you're finishing your studies. So you might feel very insecure about reaching out to people. This might feel like, oh my gosh, this is so hard. I have imposter syndromes. Where do I focus my efforts? Like, networking or job application. I don't even know what job titles to search for. This is what some of you wrote in that first question that we asked. I don't even know what those job titles ever mean. And I don't even know how to manage these rejections. That's why at Alanda, 2 years ago, we started building a course and a community that's called Thrive. Thrive is a course, it's called Thrive, How to Build a Meaningful Career in Global and Public Health. And it's for people who are struggling in career development and job hunting, specifically in our sector. Over 80 people have taken the course since, and we've had about 6 cohorts of people taking this course. And the beautiful thing about this course is that it also has a community attached to it. So if you've taken the course once, you become part of that community of peers. And it's a fantastic peer support network. So today, I'm going to tell you a bit more about Thrive in a bit, but today I just want to introduce you to one of our Thrive course alumni. So this is someone who took the Thrive course and is here to tell you a little bit about her experience and what it changed for her. So welcome, Dina. If you can turn on your camera and your microphone, we would love to see you. Hey, can you turn on your microphone as well? It's by your name. There you go. Great. You're a bit
I'm sorry. Yeah, I am a bit in dark. I'm actually outside the city. We are in cabin outside the city, so we are a little bit dark.
That's very romantic. That's great. Welcome, Dina. Thank you so much for being here.
Thank you for inviting me.
It's really good to have you and to see you again. It's been a while, I think. So
yes.
I'm just going to introduce you, but correct me if I get anything wrong. But you're a pharmacist, right? And you're finishing your master's in global health. Is that correct?
Yes, I have 1 semester left with choosing my master thesis. So that's the second step that I need to choose actually right now.
Brilliant. Fantastic. So Dina, I think what I wanted to talk to you a little bit today is your experience in the Thrive course, so other people can hear what it looks like and the benefits that you can potentially get. So could you tell us a little bit about where you were like before joining Thrive? What were the challenges that you were struggling with? What led you to join Thrive?
Yes, I think I will need to repeat that thing that I said the first meeting, that I said on the first Thrive meeting, that I was actually on crossroads because it was like I started my studies with like clear goals, what I need to focus on. And suddenly there was like too many options and I got like a little bit lost and I thought, oh, maybe I'm interested in this and what I need to choose. And on the way, I lost a little bit my inspiration. So I was following Alanda Health on the LinkedIn. So I saw this announcement about the trial course, and I think, okay, this is the right place for me. So yes, and I was like a career switchers from this group because I was like changing my career from pharmacy to like global public health, and there was like some other things that also has been influencing me because when I was working as a pharmacist, I actually never like have been applied for job. I was like contacted from other persons through my network lists and so on. So I didn't have like these skills, how to apply, how to like write my CV, how to attract possible employers and other things. And also I was also thinking that is very important, as you said already, Candela, this is like networking skills, because I don't think so that we are very focusing on that on university. There's like other things that is on focus, but beside the knowledge that we are getting on the university, I think the networking skills is also very, very important.
Yeah. And tell us a little bit about, how did Thrive, or if and how the Thrive course helped you with these challenges? What components of it were useful to you?
I think the most useful thing was like there was like this modules about different options in global public health. So you can, oh, I can work there and there. And there was like webinar session with other. I think it was the last webinar that we had on Tribe course, where it was like different people speaking about how they switch careers. And this was very, very inspiring for me, actually. And I need to like also name the cell knowledge and imposter syndrome course. And there's like weekly challenges that was like we needed to write on this LinkedIn group every week. And there was like, and that week challenge was like you need to like contact 3 persons from your networking list. And I was procrastinating, I think, until Saturday. And I'm just like, I need to write these messages and how I will do that. And then was like, okay, click send, and it's done. So
Accountability.
accountability, yeah, because you need to like share your experience, share your how you did this exercise, and you're like, okay, I need to do this. But I think everyone was like so inviting and so encouraging, and also it helped that we got like these feedbacks that we like, oh, I did that and did that and how it went, and you are getting like feedback from you, Candela, and other members of Tribe community, and that is very, very inspiring and encouraging.
That's great. That's great to hear. So, can you tell us a bit, how where are you at now? Like, what, from the challenges you were facing when you started Thrive to your post Thrive experience, how does that look like? Because this is what we care about, right? Like the impact, not just that you enjoy the course, but that it actually helps you in your career development and job hunting and, building your network.
Yes, I understand. I think also I have learned like many things about how to write my CV,
Mhm.
how to actually build contacts, how to like reach out and like do these personalized messages. And I think I got also very, very many useful tips how to apply for jobs, and also how important is that many of these job opportunities actually doesn't go online, as you said about Iceberg. And that's why I think networking is very, very important, that and do like this on your like personalized way. If you are like more introverted, so maybe you need to find like technique that works for you. And yeah, and not to be afraid. Yeah, as I said, I am like on my last semester, so maybe I'm focusing more now on master thesis and so on. But I think that when I'll be finishing my master grade, so this job application skills will be very, very important. And this is what I'm taking with me. And actually, today I was hearing your answers and how you told about, and yes, I need to like remember this.
It's a
It's
good
very
reminder.
useful. Yes,
Yeah.
and also community. This is very inspiring because as current and future global health workforce, this is very important to build like these teamwork skills and how to discuss, how to encourage each other. And this is also very important that you get this safe environment where you can like also practice your skills. As we had these like tribe meetings, so we were doing this. So I think also this is very important that as for career switcher, and actually when you are looking for new career opportunities, because you can't get like a little bit lost or and discouraged. So I think these are the main tips that I'm taking with me.
Great. And Dina, you mentioned something in the beginning that I think is super important because it hammers home the point that I was trying to make, that your pharmacy job opportunities have come very naturally to you. You haven't had to go out and get them. But this is, it's going to be different when you actually start looking for jobs in global and public health. So I think that, brings home the message about this, under the water jobs in the Iceberg model. But I wanted to ask a follow-up question about that. How do you think your network, what is the strength of your network, of your connections, or the size of your network of your connections before the Thrive course compared to today?
I got like some of contacts from Thrive course that we are actually holding contacts also right now. And through the Thrive course, I had like this Thrive buddy that we were encouraging each other, like, yes, we can do this, and just do it. And also, I think that I got like this feeling that it's like natural to reach out to people and just like try and just maybe not think too much about where will it get you, and like also like don't do this like, oh, I'm asking for a job, as you said, but like build this naturally and use like this people and communication skill, like to build this relationship. And maybe someone will get like some information that will be helpful to you, or you can help to someone with information that you have. Like also it's very important to hold these contacts, like maybe like regularly to reach out and like, oh, how are you doing, how are you feeling, and like build these like relationships. So I think this is also very important, not to lose this. And of course expand your, if you are like if you are seeing on LinkedIn some like interesting people that you want to reach out, just like, oh, I think that your like work that what you are working with, it sounds very like very interesting, can we have like a short chat or something like that? I am very interested in that. Like people like that you are like, oh, I'm interested in your job, so okay, this is like important to someone also.
Of course. Yeah.
Mhm.
Great. Dina, thank you so much. Thank you so much for joining us and for being here. And it's lovely to, for those of you who don't know it, the Thrive course is forever. So it's not forever. We'll see how long it lasts, but you have lifelong access both to the course and to the community. So all the people who have gone through the Thrive course are still part of that community. And we try to, get them together throughout events and so on. And I think, as you were saying, this community is a big part of what makes Thrive very strong, and creating those, building on your peer networks at that level. So it's lovely to have you and to see you again, and thank you so much for joining us today.
Thank you,
Thank
that was
you.
very lovely, thank you.
So then you heard from Dina, and now I'm going to ask Valerie if you can put up the slides again so I can tell you a little bit more about the course, and then we'll open up for any questions that you have. What we've tried to do with this course is to improve it based on the feedback that we receive every single time from the participants. We do it by cohorts. We have 3 cohorts per year. So if we open up a registration 3 times per year, and we continuously improve it. And any additional webinars or materials that we build during that cohort, we put them up there so previous and future cohorts can access them. So what is the Thrive course? It's a 6-week course, online, self-paced. You get access to all the materials at once and you take it. I mean, we have planned it over 6 weeks and you will get one email per week over 6 weeks. But other than that, you work at your own pace. What's the benefits that you can get from it? And we know these from experience and from, interviewing our Thrive, we call them Thrivers, or Thrivers are like Dina. So they get more job interviews. Some of them have gotten into jobs and have written to tell us, hey, thank you, I've gotten a job after this. They get better at building their networks, as Dina just told you. They just get more confident. They build an internal peer network through the Thrive community that can be really important, both for support in the job hunting, but also for contacts, because different people know different organizations, right? They get benefits in terms of improving their CV and their cover letter, as you already heard from Dina. And they get clear on the opportunities that are out there and which opportunities they want to pursue. So we help them get clear on, this is what I like, this is what I don't like, this is what I'm interested in investing out. So those are some of the benefits that you can expect from the Thrive course. It's a 6-unit video-based training, as I said, and there are some written materials as well. We have a workbook, so we want to make it really practical. So Dina was talking about weekly challenges in the online community, which is on LinkedIn. You get these weekly challenges, which are aligned with the work that we have in the workbook. So you can, have some accountability on actually doing the work. Because if you take the course and you don't take action, you won't see any benefits. So we really push and support people to do the work. And that might mean, we give you examples of good, bad, and outstanding cover letters, so you can use them as models to improve your own cover letter. Same for CVs. There's peer-to-peer checking of your cover letter and your CV to help each other improve it. So I think the most valuable part of the course is the community. That Thrive, it's a close community of peers. So if you're not on the Thrive course, you can't access the community. You'll find accountability partners, support buddies, peers who are, either career switchers or, just out of your university like you are. So people who in many ways are facing the same challenges that you are, and who are also, looking to jumpstart their career in global and public health. You get a similar webinar to this one, but just for Thrive people, where you can ask any questions that you want from me. We have now installed, and these are very popular, this is what Dina was talking about, we have now guest webinars where we invite 3 to 4 people with a diverse career story, a diverse career path, working in different type of organizations, some junior, some more senior. So you can really get inspired and motivated and ask questions directly from them on, how to get into WHO or UNAIDS or whatever it is, right? So these have been really popular, and we post all the recordings from those webinars into the Thrive course as well. So everybody has access to them, even if you were not able to attend. And we have a lot of bonus material, which includes lists of our favorite websites on where to look for jobs, trainings, and work opportunities. A list of common job titles and what they mean, like what is a project manager? What is a project? How is it different from a project officer? Should I be looking for a health outreach officer opportunity? And then a list of my favorite books and podcasts and TED Talks around career development and job growth. So the question that we get a lot is this course for me? So who is this Thrive course for? If it's for you, if you're finishing your master's or similar degree in global and public health or any related areas. We have people that come from health economics or epidemiology or blah, blah. I think it works for all those cohorts that have something in common with global and public health. And it also works for career switchers. And we have some specific materials for career switchers. So those are people like me, like Dina, who we come from a different background. We studied we studied science, we studied biology, we studied pharmacy, we studied medicine, we studied physiotherapy, and now we want to switch to global and public health. And we feel like we don't have a network and we don't even know what the opportunities are here. So it works for both those groups. If, on the contrary, you are someone who is just finishing their bachelor's, or at an early time point in your career, this course might not be for you, because what we want is immediate results. So the idea is that you would be actually applying what you learn in the course to get more job interviews and more job opportunities. So you might want to wait a little bit if you're a little bit early on, even if you're in your first year of master's, even though I think networking should start as soon as possible. So you've heard from Dina on how Thrive helped others. I can also share very briefly some of the testimonials that we get. Caitlin recently took the course and very recently shared with us that she had managed to get a job. Sylvia has been with us also from the last course, I think, and she has gotten a lot of more job interviews and actually did very well in those job interviews thanks to what she learned with us. So you'll see a lot more of these testimonials from previous drivers in the page that we'll share at the end. But I think a lot of people, what they really appreciate is the community. And we've held like equally minded, like-minded people and the support that they get in the community. So that is a little bit about the Thrive course. I think Valerie is going to share with you now, and then before we close in the chat, the link where you can get all the information about the course. And what we are going to offer for the people who have been in this webinar today is a 24-hour discount, 20% discount code. For those people who actually are not able to pay for the course, it's supported by Alanda, so we price it very low to make sure that students can access it. Basically, we do, for those people who even cannot access it at this price point, we do have a small amount of sponsored seats, but we do ask that if you can pay for it, you leave those seats for people who actually are not able to pay for it. So the link is there. Don't go there just yet. Stay with me so we can ask questions. I can hear your questions about global and public health. But if you're interested and you think you might need some more support, do go there at the end of this webinar and read through it. And if it's a good opportunity and what you need right now, then make sure to sign up. So I am going to go to the Q&A, which is my favorite part. And now it's over to you. I think we have a lot of questions in the chat already. I have not been able to keep up. So if you give me a second here, I'm going to read and go up here. And before we get started on the questions, maybe one last question for you. Have you ever posted on your LinkedIn that you are looking for a job or an internship or a PhD opportunity and asked others to give you any leads? And this can have been done on your LinkedIn or on your email. So would you type in the chat yes and no, and we will get a bit of an idea of who is using this very useful tool as well. No, people have not done this. Aha. So 2 of the people in the Alanda team have done this recently with really great results. So if you're curious about how well this works, just, reach out to Valerie or to Coralie on LinkedIn and they'll tell you about it. This is a great strategy. Okay, questions. We have quite a bit of time for questions, so we're good. We have like 25 minutes. What are the requirements necessary to become an epidemiologist? If you have an epi degree, that's great. I think that's the obvious one. But you don't necessarily need an epi degree to get an epidemiology position. If you have very good epi skills, even if you have public health or medicine or whatever, I think you can probably get a position as an epidemiologist, even if you did not train as one. There's a lot of courses online that you can take to reinforce your ability, your epi knowledge and skills. And many of those are free, so I encourage you to go look at those. Remember, the WHO Foundation has so many courses today, and they're all amazing. Well, not all, but a lot of them are amazing. So look into those. But you need good, quanti skills. You need a lot of good quantitative skills and understanding of, the different types of evidence and quality of evidence and different types of studies and different types of methodologies, etc. So it's probably one of the most scientific oriented areas of public health. Not that I think epidemiologists would like it if I call it public health, but that is a discussion for another day. Okay, question number 2. This is just a comment. I usually personalize the summary on my resume and I don't change anything else. What part of the resume should we personalize? This is a great question. I love it. When you look at the job application, it has a list of, either responsibilities or abilities or skills needed or whatever. This list is your guidance as to how to personalize your CV and your cover letter. So in your CV, if you have different experiences, try and highlight more or write a little bit more at length of what you did in some of those jobs that link to some of these. In your cover letter, then you have time to write a little bit more in depth. So actually write about, if what they're requiring is quantitative skills, then describe in detail how for your thesis, and this doesn't have to come from jobs, right? It can come from your studies. How for your thesis, you conducted a cross-sectional analysis on blah, 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 but explain it in detail what you did and the results that you got, and if people really liked it or, praised you for it or whatever. So explain exactly what you did in a little bit more detail. So people, if you just say, oh, I did a quantitative analysis on blah, blah, that doesn't tell me much. Explain to me a little bit, take 2 lines to explain the methodology, the results you got, and how people liked it. Okay. Similarly, like they're requiring excellent writing communication skills. Nothing says that it's not allowed to, put a link in your cover letter or your CV saying, I have been writing for my own blog for the past blah, blah years. And here, is a link to some of my best writings on global health topics. And you just add 1 or 2. People are not going, they don't need the whole list. You can put the whole list somewhere else, but just give them a bit of examples of your writing. And remember, if they're looking for writing skills and your cover letter is not well written, that is not good, okay? That was a great question about how to personalize your CV and your cover letter. So thank you for that. How to get into pharma companies as a freshman with a Master of Public Health degree. What kind of skills can we highlight? Your quantitative and qualitative data collection and data analysis skills are definitely useful in many pharmas. Your research skills in general would be useful. But, many pharmas have, points of contact with patients that use their medicines. So, pharmacovigilance, pharmacoeconomics, anything that you've done in your MPH that link to those areas is also possible. Health promotion, many of pharmas have health promotion opportunities because they do a lot of health promotion, very geared towards many of their medicines in some cases, but they do that. So there's a lot of skills from our Masters of Public Health and Global Public Health Studies that can be really useful. Writing, science communication, health promotion, health outreach, talking to patients, particularly have like a dentistry or medical background and then did a Masters of Public Health, that you probably have those skills. So that's really good. Where is the best place? What is the best way to look for those jobs you mentioned and sub-job titles that we should look for? Job titles that you should look for really depends on what you want to do, but you need to understand the difference between a project manager, a project officer, a program manager, a program officer. Officer normally denotes something much more administrative. than a project manager, which might be more coordination. You have technical advisors, which normally require a little bit more experience, so they're not necessarily entry-level jobs. You have health outreach, health coordinators. So there's a huge variety, and they change by industry and by sector as well. So we have collected a big list. You can get it if you access the Thrive course, but we post some of these, on our LinkedIn as well. So you can look there to see what we have to say about some of these. But you can Google it as well. I mean, there's a lot of it out there. So to try and understand what it means, and then read the job description, because the same title of project manager can mean very different things in two different organizations. What is the best place to look for those jobs you mentioned that are the ones that are underwater? I think we understood that is through networking, and through you just strengthening your networking and those connections, and making sure that people know that you're interested and you're open for job opportunities. And they know what you're interested about. So if they hear about something, they might send it your way. So you need to be very specific about what you're asking for. And again, we cover this a lot in depth in the Thrive course. What are the career opportunities for a recent graduate pharmacist with a bachelor degree in public global health? I think we talked, I already answered this question about biopharma positions and how global health skills can help in there. So I'm not going to go over that again. Can you point out to a specific master degree online to enroll to? No, I can't. There's so many out there, and it really depends on what you want to do. I really recommend the podcast that's called Public Health Insights. They're on LinkedIn. You can find them, Public Health Insights. At Alanda, we repost some of their material. They're really good. And they have a lot of recommendations on different masters and different courses, both free and paid, that exist out there. So this is a great reference. Go look for them. Someone has answered someone else's question from a person about getting into pharma companies. From my personal experience, I definitely try to attend recruiting events and network with people and organizations that can get you more information. That's great advice. Career fairs and career events are very common for private companies, not as much for other type of organizations, but those are a great place because you actually get to talk to people face to face. Ask a lot of questions, meet lots of people, and build connections. I hope this helps. That is very good advice. I'm not sure who wrote that, but thank you for that. What kind of roles can I look for as I am a recent graduate and Master of Public Health, Global Health? Is a career diversion for me. I just have 8 months of internship with public health with a background in medicine. I am totally lost to what roles I should look for. How much of the job requirements should I match? I like this question. So if you're totally lost, the first thing is to understand where your interests lie. You can get a hint of it from what you liked and disliked from your previous career in medicine or whatever it is, and what you liked and disliked from your master's in public health studies or global health studies. So you can get some people already tell me, I like policy, I like advocacy, I like implementation. Other people don't really know. And that's okay. You can take on a job that sounds interesting for 2 years, and maybe at the end of 2 years say, I want to try something else. That's totally fine. You're not committing for the rest of your life to a job. And I think that's also important to remind ourselves of. You can also try different internships or volunteering opportunities to get a taste of what different jobs might look like and what working at different organizations might look like. And then the second part of the question was, how much of the job requirements should I match? Here is some interesting data. And if a lot of you out there are women listening to me right now, it turns out that the majority of women, we feel like we need to match 100% of the requirements in order to apply, while on average, men feel confident in applying if they just match about 50% of them. So that is for us to step up and be more confident. I would say that if you match, the first thing to know is that not all requirements are created equal. Normally, the most important requirements come at the beginning and the rest come later. And it really depends how they are recruiting. Sometimes if they're using like, bots or as an automatized system, they really check for all those requirements in a more automatic way. So you might not even get a chance. But I think more and more organizations are realizing that they don't need to ask for this particular master's and that the equal level of experience might just be enough. So years of experience is actually important. Remember that if you volunteered for a long time, that if you worked as an editor for your science journal for 2 years, even if part-time, this is also work experience, right? So remember to count those experiences, even if they were unpaid. You've gained very valuable skills, okay? And highlight those on your CVs, etc. But in general, so I would say if you have about 65 or more of the requirements, considering that not all the requirements are created equal, go for it. I mean, what is the worst that can happen? That you get a no. I think the only thing is if you're aiming for a position that is, clearly very high, like if they require 5 to 10 years of experience and you have 1 or 2, maybe wait a little bit. The thing is, it takes a lot of effort and a lot of hours to do a good job application, because then you really need to understand what the organization is about, read about the organization, personalize your cover letter, personalize your CV. So it takes quite a bit of effort. So you want to be using those hours and putting that effort into opportunities that you have a good chance of getting, as opposed to opportunities that are too high or even too low for which you're overqualified. So think about it that way as well. What are the necessary skills or requirements to land a job I think I already answered this. Some good books that helped me figure out what skills align to what I want in a career, and to learn more about public health careers are 101 Public Health Careers, and you don't have to be a doctor. Okay, thank you for that. The problem is that we don't have enough public health opportunities, especially in the middle list, which forces us to switch to other careers. Yeah, I understand that. I just think sometimes public health opportunities are called something else, so also be aware of that. And a job that is called something else but requires a lot of public health skills might still be quite fulfilling for someone with a public health degree. So just open up your mind to that possibility. There's some very specific questions that I'm going to skip because I'm not really able to answer them. So apologies if I'm not answering them. It means that I really don't have the knowledge to answer that. They're asking for the link of the book. So whoever recommended the book, please share the link. Most of the global health jobs are less about health inequalities or planetary health. How can I find a job that matches my interest? I have my own vision and project ideas for global health. It is hard for me to find a fitting organization. I'm sure there's an organization that fits your needs. And if there's not, then you can build one. But to build one, you might want to, go through 1 or 2 jobs to build your skills and your talents. But if you really can't find an organization that meets your interest, then you can build one for sure. I'm looking at the questions here. And for planetary health and health inequalities, or, think about how you search for those organizations. I think there's more and more organizations working in these areas, but they might not be calling it that. They might be calling it something else. So you need to think creatively about the synonyms that you're looking for. Sustainable, anything related to sustainability that has a health component, One Health. So yeah, try different synonyms to maybe look for organizations that match your interests. What are the minimum years of experience to start my career in epidemiology and biostatistics? It really depends. I mean, there's entry-level jobs in every single sector, right? So it's always good to have some experience, and you get that experience from internships, from your studies, from working. I think there's always a lot of opportunities of helping out your teachers and your professors and getting some hands-on experience to analyze data, for instance, while you're still doing your studies. But yeah, so there's ways to get experience even during your studies, even through volunteering, and those are great. So you don't start from zero work experience where you're just starting when you're just finishing your studies. But I don't think there's a minimum. I really don't think it is. Of course, there's entry-level jobs and more senior jobs, but that's all. There's a discussion on the books on the chat, so I'll let you to read it. Will a good LinkedIn profile help with responses? Yes. A good LinkedIn profile, I think, is helpful. It's not like a joker or get out of jail card that it would immediately get you a job, but it's part of your due diligence, of your homework. Have a good LinkedIn profile. Write a good short about statement that is geared towards what you want to do, where you want to go, not necessarily about your past. Have, detail a little bit about your experience, even in your studies. Did you participate in any volunteer opportunities? Were you part of the university journal? Were you part of the university association? Any leadership experience that you gained during your studies? People will not know this just because you said that you studied this or you had this job. So give them a little bit more information about each and one of your positions, whether voluntary, internships, and talk about the results you managed to get. Results-oriented profiles are always very interesting to read. So do your due diligence, good LinkedIn profile, good cover letter, good CV, understanding of the organization that you're applying to. Make sure you do your homework. But it doesn't mean that automatically you get more responses or anything, but it definitely will help. Thank you. I will try this approach. Thank you. Very useful tips for networking. Super helpful networking tips. Thank you. Does the position the person assuming in the organization matter? That depends on what you want to know about the organization. It's always helpful to talk to anyone in that organization, but the closer the position of that person to the type of jobs that you're looking for, the more interesting and the more information you will get. If it's a large NGO that has a water hygiene and sanitation sector and a health sector, and you want to work in the health sector, but you talk to someone in WASH, it'll give you a good overview of the organization. They might have contacts in the health team, but they might not know as much about the health projects as someone who actually works in the health. So definitely really worth your time. But yeah, so I would say, any person in that organization will give you some good information, but the closer to the type of positions you want, the better. What strategies and approaches are most effective in implementing in public health initiatives on an international scale? And how can I position myself to contribute meaningful to such efforts within international organizations? Wow, I think this goes beyond the scope of what I'm trying to answer here, and that is a thematic for a whole different webinar. So we can take that on when we talk about health equity and evidence-based strategies. But thank you for your question. How can fresh graduates in public health address the unique challenge of bridging the gap between theoretical knowledge and practical skills, which often arises when seeking for job opportunities? Well said, yeah. I think I already talked about this. While you're doing your studies, hopefully, but worst case scenario, at the end of them, internship opportunities, volunteering opportunities. Many NGOs will take you on as a volunteer for a few hours a week, if you're willing and able to do some unpaid work. And I'm very conscious that not everybody can, and that this is a privilege. But you can do some work from them, even remotely, right? Like you can send me your data. I'll analyze it for you at home, or I can help you develop, a little health promotion campaign here. So offer some ideas proactively, and I'm sure you'll get some opportunities there. Supporting your professors, asking your professors to work in any of the projects that they have. Student associations, this great leadership and networking skills, really good. What else? I see a lot of people who have done, for example, supporting the school journal. And if there's not a school journal, why don't you build it, right? Or the school social media. So there's always good opportunities to get some hands-on work done and bridge that theory to practice gap that you're talking about whilst you're still doing your studies. Am I getting to the end of the questions here? What are some companies you recommend to look into for entry-level or internship opportunities? Oh gosh, there's so many of them. I don't think I can recommend one in particular. It really depends where you want to go and what sector you want to look into. And if you were not here from the beginning of the webinar, I covered a little bit of all the different type of organizations that exist, the universe of organizations that we can potentially work in as global public health professionals. So you'll get the recording tomorrow and you can look into that a little bit more in depth if you miss that part of the webinar. For the Thrive course, now that we have more information and there are limited seats, would it be beneficial to email the Alanda health team when we are looking to apply? No, the registration process is automatic on the web page. So if you're ready to register, go for it. If you're looking for a sponsored seat, there's also the instructions on how to request a sponsored seat, and those are limited as well. So you can do it all online. The only reason to contact us is if you have questions on whether this is a good fit for you. And please, before contacting us about this, read our frequently asked questions section that is on the Thrive page. We answer, I hope, most of your questions there, but if you still have doubts, do contact us and someone will reach out to you. Thank you for hosting this session. Great information shared and received today. I appreciate all of your support. Thank you for being here. For someone with a bachelor degree in pharmacy, how can I enter the public health, global health path? And how and where can I get internship opportunities as an entry level with no experience? Internship opportunities, I don't think most of them require previous experience. Remember, there is no such thing as no experience. You have experience from your studies. I just need you to go back and, write all the projects that you worked on during your studies, and then what you learned from them, and be able to pull out the skills that you got from those study experiences. There's no such thing as zero experience. Your studies gave you some experience, okay? It's not potentially the same as working for an organization, but it's not zero. I am running out of time here. I'm going to be able to answer maybe one more question, unfortunately. But you do follow Alanda. We try to keep going back to many of these questions in our posts, and hopefully you'll get an answer if you don't get one today. And I apologize that we're running out of time. Do you have an example for an organization that provides services to other organizations that you had mentioned? Yes. Well, Alanda does that for once. There are many consultancies from the big ones like KPMG and PwC that now have departments focused on international development, and they normally have someone in public or global health. Gosh, I can't remember the names, but we can post some of those names we can do a post about that. I think that's a great idea, Valerie. Can we write that down? A post about these type of support services organizations, because we actually have some ex-interns from Alanda that have gone on to work in some of these organizations, so we know a bit about them. I have 2 more minutes. Any recommendations for organization initiatives that combine public health plus medical device industry? Yes, I forgot to talk about that category. Thank you for this question. There is a fantastic category of organizations that normally have some cool opportunities if you're willing to potentially not get paid as well. And these are startups. So there's a lot of health and health tech startups out there. And startups just means like a very small organization that is just starting to flourish. There's a lot of programs catering to these organizations when they see that they have good potential to help them get funding from, investors and other type of organizations. And in many countries, there's more and more like environments where these startups tend to congregate. So look it up in your own country and see what those environments are. They normally have regular meetings. There's there's this whole thing going on in the startup sector in many countries, and it's really useful to look into that. The cool thing about startup job opportunities is maybe they don't pay as well because they don't have as much money, but they allow you to try on different hats. They require a lot of your skills, management skills, coordinator skills, writing skills, technical skills, all sort of different skills. So you get a chance to practice a lot of different skills because they're less structured. So you need to just do anything that needs to be done in the organization. We're out of time. I am so sorry. Thank you everyone for being here. There's a lot of good stuff in the chat. I didn't get through all the questions, but we'll try and do some posts around the questions that we didn't manage to answer. So, stay tuned on LinkedIn for Alanda posts. You'll get an email with the recording tomorrow, and today, right after the webinar, you'll get an email with the coupon and the link to the Thrive course. So if this is something that can help you, be sure to connect. We'd love to have you as part of the Thrive course. And if this is not the right time, or if this is not the right fit for you, that's totally okay. I'm super happy to have you here on the webinar, and I hope some of what I said was useful and you'll apply it in your next job hunting. So Valerie, if you just want to pop into the chat the link again, that would be great. Thank you so much for organizing, and thank you all for being here. And we'll see you soon at the next webinar in about 3 months.